What does an osteoporosis diagnosis involve? Imagine a silent condition that can quietly weaken your bones without any obvious signs until a fracture happens. That's why understanding how osteoporosis is diagnosed is so important. The main tool used is a special imaging test called a dual-energy X-ray absorptiometry scan, or DEXA scan. This test is quick, painless, and involves lying still while a machine measures your bone mineral density in key areas like your hip, spine, and sometimes your forearm. It's non-invasive and takes only about 10 to 15 minutes. The results from the DEXA scan are given as T-scores. These scores compare your bone density to that of a healthy young adult. A T-score of -2.5 or lower indicates osteoporosis, meaning your bones are significantly weaker. Scores between -1.0 and -2.5 suggest osteopenia, which is low bone mass that might develop into osteoporosis if not managed. Before the scan, your healthcare provider will ask about your medical history and perform a physical exam. They look for risk factors such as age, family history, lifestyle habits, or previous fractures. Since osteoporosis often has no symptoms until a fracture occurs, screening is especially recommended for women over 50 and others at high risk. Sometimes, blood tests are ordered to rule out other conditions that can cause bone loss, like hormonal imbalances or vitamin deficiencies. Your doctor might also use tools like the FRAX score, which estimates your chance of having a fracture in the next 10 years based on your age, health history, and BMD results. This helps guide treatment decisions. In summary, diagnosing osteoporosis involves a combination of clinical evaluation, bone density testing through a DEXA scan, interpretation of T-scores, and sometimes additional lab tests. This comprehensive approach helps detect bone loss early, even before symptoms appear. Since osteoporosis is often called a silent disease, regular screening is key to catching it in time and preventing fractures. Always remember, if you're concerned about your bone health, consult a healthcare professional for personalized advice and testing options.